What you'll see right here is the three phases of vaccine distribution as created by the Center for Disease Control, CDC. Phase 1, Phase 2, and Phase 3. You see there in Phase 1, first we're doing 1A, healthcare workers, along with long-term care facility and staff residents, the red box. That's where we are right now. When we complete this, we go to 1B, essential critical infrastructure workers. You complete 1B, you go to 1C, adults with high-risk medical conditions and adults age 65 and over. Once you complete those, you're done with Phase 1, and then we go into Phase 2. Children and young adults, 30, other critical workers, you complete Phase 2, you go to Phase 3. So that is what the totality of the process will look like, and we don't know how long it's going to take because we don't know when we will get how many vaccines, but we know the order in which we will work through them. But what is primarily important is where we are today. And so let's go to the second slide and let's look at what Phase 1A. This is what we're looking at now. These are all of the folks that we will treat in the first batches that come in, and this is the order in which we do it. Again, we've broken it out of an effort to be incredibly transparent around all of the sequencing of what we will do. So you see there where we are in the red box. This is who is getting vaccines today. Acute care, psychiatric and correctional facility hospitals in San Diego County. Now, it's important to note, we don't have correctional facility hospitals in San Diego County. If an inmate needs a hospital-level care, they are transported to a hospital and then returned. And so essentially what we are doing right now today in the red box is those staff that are at acute care, hospitals, and psychiatric facilities. When we get done with those, you can see the order at which we will continue to progress from the top of your screen down to the bottom. Now, how many folks are in this red box that are getting the vaccines right now today? Let's go to our next chart. There are 82,623 San Diegans who are healthcare personnel working in acute care, psychiatric, or correctional facility hospitals, with the understanding we don't have that third category. So 82,000 in San Diego County, healthcare workers in acute care or psychiatric settings. Out of these, again, we're going to go based on their risk. 1, 2, 3, 4. Those 4, as we run through based on risk, will get us our 82,000. To date, we have received just over 28,000 allocations of vaccines to the San Diego County region, and those are going to the individuals you see there in the red box. The highest risk individuals, healthcare workers in acute care hospitals and psychiatric facilities. Now, you need 2 shots, 2 doses of the vaccine, the Pfizer vaccine, separated by 3 weeks. We got 28,275, and the state held back an additional 28,275 that will arrive at the appropriate point so those same individuals can get their second dose. As we get more batches of vaccines, that will be the first one. They will also be holding back the second one to send those a few weeks later, and we have a registry and tracking system to ensure that everyone who got the first one can come back and get the second one. So again, this is where we are today, and you can tell we've got a fair amount of work to do. We've got to get a significantly larger number of vaccines just to be able to cover our healthcare workers in acute care and psychiatric facilities. And then after we complete this, then we will go down the line that we've shared with you and the sequencing of what we have in front of us. So there is a lot of thought, there's a lot of questions, that's understandable, but what we are doing is administering the vaccines we get with the plan we have in place for the folks who need it most, and we will continue to work through this process that has been created, again, at the federal level, and is important for us to follow that and continue to go, along with providing updates about what we know, with how many we have and what we expect to get.